This is Phil Jacobus, and today I'm interviewing Niels Van Vliet. Niels is with BR Medical, and he lives in Mexico City. He was born in just outside of Rotterdam and moved to Mexico City in 2004. Niels, how are you today?
Good, thanks for asking. Under the circumstances, doing well.
And how are things in Mexico City now?
So things in Mexico City are getting to the same level as in Europe and the US. I think we have about 2 or 3 weeks delay of how we are acting in Mexico. Just this week, we really see the differences with people using the mouth protection. Home office is now more standardized. And the reason that we are a little bit delayed is because our government didn't give straight orders in the beginning how to act under the new circumstances of coronavirus.
What about the demands at the hospitals? I know you're in healthcare. I assume that demands are higher at hospitals?
Correct. Hospitals, there are 2 lines of hospitals, private and public. The public hospitals are giving the attention for coronavirus patients and testing. The private hospitals are taking over the normal day-to-day healthcare of the public hospitals. And I'm talking about gynecology, oncology, orthopedics. Of course, anything that can be postponed will be postponed. So in our business, which is basically sports medicine and spine, we see that everything is being pushed back towards perhaps June or July. And in the public health sector, we see a lot of demand for basic materials, gloves, mouth masks, disposable clothing, etc.
And where are these, do you know where these products are coming from, the gloves and masks and disposable clothing?
We have some national Mexican companies that provide the disposable clothing. The gloves are mostly from China and India. And at this point in time, basically any material that is offered can be imported if it's just basically materials. But most of it comes from India if it's about gloves.
Are there shortages?
There are, absolutely, absolutely.
Are people stressed out in Mexico City over the coronavirus?
It's an interesting question. Lots of people are, and a lot of people are not. In Mexico, you have a lot of people that live day by day, have not official jobs. They sell, for example, food on the streets. They have small stores, and those people, they tend not to worry too much because there is no possibility to stop their activities. They need to continue producing just to put food on the table. So those people tend to be undercooled about the situation. Other people, I guess middle class or upper class, they're at the moment getting in panic mode for the coronavirus, but also for the economic victims that this situation is getting at.
And are there, is the economy in Mexico suffering as a result of this virus?
Absolutely. For Mexico, tourism is a very important income. And of course, that went down, and the prognosis is that it won't pick up anytime soon. Of course, Mexico is not benefited by the low price of oil at the moment. So yeah, we are really suffering at this moment.
What about, how will the healthcare system in Mexico change? Do you think it will as a result of the virus?
It's a very good question. Mexico suffers from a population with a lot of overweight and a lot of diabetes. And that makes our population kind of weak to protect ourselves for the coronavirus. What will change? I think that Mexico has to invest very strongly in preventive medicine to get the population healthier than it is today. And we have to get modern and use the techniques of artificial intelligence. There are some products on the market that are not available in Mexico yet. And I think the preventive screening is something where Mexico has to invest in heavily to prevent situations like these.
How robust is the online or virtual consultation between patient and doctor in Mexico? Does that exist there?
It does exist, but it's very small and it's only in the private hospitals. It doesn't really occur in the public sector just yet. And maybe I can expand a bit on my answer on this. I think that we have a lot of good physicians, well-prepared physicians, and very good nurses in general. I think the problem of Mexico is that we don't give enough tools to these people to actually execute the job as they know how to do.
And are there any positive takeaways from this experience that we're all going through?
That's a very good question. I think in the long term, the positive outcome is that people will take more interest in their health in general. And that might be a good thing. For example, Mexicans is the #1 consumers for Coca-Cola products. And perhaps right now with being put with the noses on the facts that a healthy body and a healthy mind is so important, perhaps we can change that kind of tendency. In healthcare today, any positive outcome so far, I'm not sure. I think that the positive outcome might be that the government gets more conscious that they need to give a wider budget for healthcare in general.
And finally, what about air quality? Has the air quality improved in Mexico City?
Yeah, that's the one good thing. Yeah, absolutely. There's a small benefit there because there's less traffic, of course. Also, the fabrics are not operating as normally. So yeah, there's some improvement there. Okay,
well, Niels, I want to thank you for joining me today. It's a privilege to speak with you, and thank you for sharing your experiences.
My pleasure. Thank you for the interview.